This is part 1 of ECG Prep. These are the materials needed when doing ECG Prep. First, we'll be looking at a female with the ECG Prep. As you can see, Dr. Jones is palpating the area of where to place the electrodes. It is different placement for males and females due to adipose tissue for V1 and V2, which you will see on the male participant of the differences of where it's placed. When we do it in class, you will be able to do it on a male and female. If there is any problems, just let me know, and we will make sure that you guys have a participant that you are comfortable and or technician that you are comfortable with working on and having work on yourself. You first want to clean the skin with an alcohol wipe. You see her fanning the skin to make sure that the area is dry before scratching the skin with something that feels similar to sandpaper. That is removing any bacteria and or dead skin cells that will affect the adhesive to stick on the skin. Mainly this tool is utilized when it comes to doing a stress test because when we do exercise we do perspire, which causes problem with the adhesive sticking throughout the test. For this test, there will be an entire utilizing of 10 electrodes. After you complete the scratch and alcohol wipe, you will then place the electrode on. You may see some redness on your skin after. That is completely normal. If there are any other problems where you see that there is more redness around the skin, you may have an adhesive allergy. So the other leads that she is placing currently, that will be V3 through V6. As you can see, V6, the last one that she placed, is on the mid-axillary line. So kind of follow it in line with the armpit. These placements can be slightly changed based off of adipose tissue on different participants. So just be cautious of that. That is one of the main reasons why we adjust the placement for V1 and V2 on females due to the more breast tissue and or adipose tissue for males and females. So for this prep, you can see she is also palpating for V1 and V2. This will be a little easier to see on that fourth intercostal space for V1 and V2. Normally, we would shave the participant. However, we don't want to use dollar razors on your guys' skin to cause any irritation or anything like that. So we will show this test and prep without shaving the participant. The same process, make sure you clean the skin with an alcohol wipe, palpate the areas, make sure that you are placing it correctly, and then after the alcohol dries, you take some of the scratch tape and scratch the areas to make sure there is no dead skin on that area that we just cleaned. It can be uncomfortable. Just make sure you're not trying to do it too hard on the participant. That may cause more irritation on the skin that is necessary. And always be mindful and ask for consent prior to doing any form of test where it has the participant without clothing. As you can see, the difference for V1 and V2 on the participant, it is lower on the intercostal space than on the female participant. It is in the anatomical position that we would want it of the fourth intercostal. As for V3 through V6, that should look pretty much the same on males and females. Sometimes with sports bras for the female, that is where there might be some slight change, as well as adipose tissue. Both these placements for male and female are the exercise or stress test placement. We will be doing in lab the resting placement as well. Now she is using the monitor that we will utilize in lab to be able to read the electrical activity of the heart. On the actual clips, it tells you the right leg for this one. So each one of those has the correct label. Make sure that when you are looking at your participant, you are flipping it to make sure that you have the proper right on the right side and left on the left side. Sometimes the wires can get tangled. It's okay if that happens, as long as you are able to, when they do a stress test, to tie the belt around their waist where it doesn't impact the wires and the electrical activity being read on the screen.